Foi bato doctor hana lo no vai doctor hansa After
Ajib Bahar's 6-month-old son fell sick last year in Myanmar war-torn Rohingya state, the 38-year-old Rohingya mother said she had no medicine or food to give him. The boy died in her arms.
Han mashagata til dada yi yo godada yere her zaire timash badoyi o yere ashto din amato fara malli shi ani yere doctor na bhai doctor hana zaina bari ere foi bato doctor hana lo no bhai doctor hansa nai bhai ki hochu ko yo to gorno hari foi ba mara giye samasha
Ajib Bahar, there were no doctor and we couldn't figure out what was wrong. When he was 6 months old, he passed away. Bahar said from a refugee camp in Bangladesh, Cox's Bazar, where she and her family sought safety after feeling violence and starvation in Myanmar in August. Rohingya state, a western coastal region that has suffered a year of conflict and ethnic violence mostly targeting the Rohingya Muslim minority, is now facing an alarming hunger crisis due to a deadly combination of conflict, blockbuster, and funding cut, according to the United Nations World Food Programme. 5 Rohingya, including Ajib Bahar and her husband, told Reuters they had survived on leaves, root and grass in Rakhine before escaping to Bangladesh in the last 6 months.
Mundo kalagas baye kalagas musuri haye tar murungor gora se tura murai tara tu jaiyore harare ke sudane haibala ke sudanang hoire manu 200 তল্লা দাজে চলে বসা দিলে একজন এপটে পড়া আদবদ নাফা
বসুন্ধরা টিস্যু অশুদ্ধতার বিরুদ্ধে এক বিন্দুও ছাড় নয়
Mohammed Idris, whenever we managed to gather a little rice after days of begging and searching, we would cook it and feed the children fast. If there was anything left, we would eat. If not, we weren't hungry. It becomes a fasting day for us, said Mohammed Idris, Bahar's husband, a farmer from Butidong Township. More than 1 lakh children in Rakhine are suffering from acute malnutrition, with less than 2% able to access treatment, according to previously unreported data provided by aid workers. Security fear and restriction by the junta and the Arakan army mean the United Nations is unable to move food beyond Sittwe. The junta control a state capital into the central and northern part of Rohingyas, said Michael Donfur, the action UN had in Myanmar.
We need an end to the conflict, we need the access, and most importantly, we also need the levels of funding to be able to scale. It doesn't make sense if we have the access, but we don't have the funding and the capacity to respond.
We need an end to the conflict, we need the assets, and most importantly, we also need the level of funding to be able to scale, said Donfur, who is also the country representative for WFP. Rohingya are arriving in Bangladesh in much poorer health than previous waves of refugees, with high rates of malnutrition, particularly among children under 5 and pregnant and lactating women. The International Rescue Committee, a non-profit working in the refugee camp, said last month. A Myanmar junta spokesman did not respond to request for comment. Raymond Palit, Kalerkantho.